video is strictly for educational purposes only. I do not condone or glorify the usage of drugs.
What's up everyone, I'm 𝗼𝗏𝗏𝗃, and in this video I'll be covering the substance called Pregabalin. This is used to treat a wide variety of issues including generalized anxiety disorder and nerve pain. Plus the effects can be synergistic with many other types of drugs by making them feel stronger, including things like caffeine, nicotine, cannabis, alcohol, and more. I'll go over the benefits, dangers, side effects, pharmacology, and everything else in between. Let's get into it. Pregabalin is a depressant substance of the gabapentinoid class due to it being a derivative of GABA and mostly sold under the brand name Lyrica. Medically, it is used to treat epilepsy, neuropathic pain, fibromyalgia, restless leg syndrome, opioid withdrawal, and generalized anxiety disorder. In the United States, it was approved for medical use in 2004 and was developed as a successor to be related to gabapentin. In 2020, there was more than 9 million prescriptions given out in just the United States alone.
Now, everything I take is by doctor's prescription.
Pregabalin has several advantages over gabapentin, which include greater bioavailability and potency. For example, unlike gabapentin, which has an average bioavailability of about 45%, pregabalin yields a superior absorption rate with over 90% of the drug being absorbed when you take it.
I feel stronger now.
Additionally, you can take pregabalin on an empty stomach for the best effects. This is quite the opposite of gabapentin due to it needing to be consumed with a high-fatty meal in order for the maximum amount to be absorbed. Although pregabalin is a chemical derivative of GABA, it displays no activity at any GABA receptors. Instead, it binds to calcium channels in the brain to create its own subjective effects. By binding to this site, pregabalin reduces the release of several neurotransmitters such as glutamate and norepinephrine. Positive effects include stimulation, pain relief, euphoria, and dream potentiation. Negative effects include headache, dizziness, trouble with memory, and weight gain due to increased appetite. If pregabalin is combined with other substances that do not affect the GABA receptors, it can make them feel stronger. Examples of drugs that it can increase the potency of is alcohol, caffeine, cannabis, nicotine, Adderall, benzodiazepines, and more. As pregabalin treats conditions and neurotransmitters associated with overexcitability of the brain, i.e. anxiety, epilepsy, and neuropathic pain, its modulation results in calming effects on the central nervous system. The risk of addiction is low, but it's still possible if abused on a daily basis. A light dose is 75 to 300 milligrams, while a more common dose is 300 to 600 milligrams. A strong dose is deemed as 600 to 900 milligrams or more. It is taken orally by capsule and will take 1 to 2 hours to kick in. Once the effects get underway, it will last 6 to 14 hours. As mentioned previously, pregabalin shares a lot of identical properties with gabapentin. Watch this video next to learn everything there is to know about gabapentin and how it compares and contrasts to pregabalin. My name is Fish and I stay low key. Remember to follow me on Instagram. Peace out.